Hi, I'm Dr. Felice Gersh, your integrative OBGYN physician, here to talk to you about blood clots and estrogen. So, you may have heard estrogen causes blood clots. Well, you probably know, if you know me at all, that expression drives me crazy. Now, why would that expression drive me crazy? Because they're saying estrogen. Well, what estrogen? I've talked about this so many times. Don't just say estrogen. Estrogen is not a hormone, it's a family of hormones. Just like you would never, I hope, say all fat is evil. What does that mean? All fat is evil, or all fat will give you a heart attack, or all fat will do this or that. Because fats are a family. There's monounsaturated, there's polyunsaturated, there's saturated, there's omega-3, there's omega-6. We won't go into fats now, but there's not a fat. It's a family of molecules that fit under the category of fats. There's trans fat. I just have to throw that in. A manufactured man-made fat that is evil, okay, increases heart attack risk significantly. It's been banned. That's what was put in foods like bakery goods so that they would never spoil and you could eat them in 100 years. Not a good thing. So what about estrogens? Well, as a quick recap, in the adult female, there are three estrogens. There's estrone, also known as E1. There's estradiol, the estrogen that's made by the reproductive age functioning ovaries, E2. And then there's estriol, E3, which is the dominant estrogen of pregnancy made in the placenta from estradiol. All estriol comes from estradiol. And in a reproductive age woman or in a menopausal woman who is getting estradiol, it will be converted in small amounts into estriol as the body needs it. So now getting back to blood clots and estrogen. If you say estrogen increases blood clots, what estrogen, and does any estrogen increase blood clots? Well, in order to understand this whole issue, you need to understand what would cause blood clots to form in the first place. So the body has an inflammatory response system, which under the particular situation, when inflammation, and the word we use is induced, when inflammation is appropriately induced, it is life-saving. That's why we have an immune system that is capable of creating an inflammatory response. And when would that happen? And it would be life-saving. If you have an infection, if you're being invaded by pathogens, okay, like bacteria, viruses, fungi, if you don't have a functioning immune system, you know what happens? You'll die, okay? Now, what else would induce an immune inflammatory response? Damaged tissue, injury. So it turns out, for example, if you're in an accident and you get a big laceration, the immune system will be activated, rush to the scene of the injury, and create an inflammatory response so that if bacteria try to get in there, guess what? Our immune system will hopefully knock them off. It's like a war, them against us. And you need to have warriors, your immune cells. Well, part of the immune response is activating platelets. So what are platelets? They're little bitty things. We get lots of them. A typical number in a blood count, when you do a blood count, would be like 150 up to like well over 250 in that neighborhood, times a few zeros. So that would be 150,000 up to 250,000 or so. Now, one of the things that platelets do is they create blood clots. Now, why on earth in an inflammatory response would you want blood clotting? Well, what if you have a laceration and you're hemorrhaging? Do you want to hemorrhage to death? That happens. Of course, you know that. So you want to do everything to clot that blood, to stem the blood loss. So how are you going to do that? To the rescue, the platelets. They come together, they aggregate, and they start creating clotting mechanisms so that you clot the blood and stem the loss. We have to stop that loss of blood. Now, that's why when people have aspirin on board, okay, so what's the action of aspirin? How does that help? And why do people who've had like a previous heart attack, why would they take aspirin? Because aspirin acts as an antiplatelet agent. And there are other agents that act as antiplatelet agents, but we won't go into that. That's not the main topic, but everyone knows of aspirin. So aspirin, if you have too much, or if you're sensitive or elderly and so on, you can actually have bad bleeding. Aspirin can cause irritation in the GI tract, and people have actually had serious blood loss and bleeding from being on aspirin. But why would they give it? Why is it given to people who've had, say, a stroke or a blood clot previously, or they've had, say, a heart attack? Because it's an antiplatelet agent, and it helps to prevent platelets from aggregating in an inappropriate manner. Okay, back to the inflammatory response. Because in an appropriate situation, you want your platelets to aggregate and create blood clotting so you don't bleed to death. Okay, that's why, for example, women who have a platelet disorder, okay, they will often have really heavy periods, like just terribly heavy. And that's why women who have that, they should be evaluated by a hematologist to see if they have a genetic type of platelet disorder where their platelets don't aggregate properly. So in the appropriate situation, like you have trauma, then you want to get blood clotting. Now, what else can platelets do? Platelets can create growth factors that can create encapsulation of, let's say, an infection. So have you ever heard of this, an abscess cavity? So how would an abscess cavity develop? Where you have a walled off section and the pus, the infection and so on, is contained in this wall, okay? And that has happened in sometimes people will have a ruptured appendix or a slow leak, and the body can respond with a pro-inflammatory response and wall off the infection so you don't have infection spreading throughout the abdominal cavity and then into the blood, creating sepsis and then going into septic shock and dying. Part of that response, it's related to platelets creating growth factors to wall off that infection. So these are two life-saving things that platelets do in the pro-inflammatory response. And from pro-inflammatory, it goes into pro-resolution, healing. The inflammatory response also includes the healing response that follows the inflammatory response. Then the platelets go into the healing phase where they create growth factors to create new tissue, to repair and replace damaged tissue and so on. So we love platelets, but what happens when you have inflammation being induced in the body for no good reason? Guess when that happens? Well, that happens as you age, or if you have an ongoing infection, like a chronic infection, or if you have cancer. Some cancers are incredibly inflammatory inducing. That's why some cancers are associated with blood clotting, inappropriate blood clotting, where you get blood clots in your arteries or most of the time in your veins. They can travel to your lungs. You can get a pulmonary embolus, or you can get a DVT, deep vein thrombosis, like in the legs. So when you have an inflammation with aging, you get systemic low-level chronic inflammation. And that can cause what? An overabundance of platelet activation. Now, that's why, by the way, the older people get, the more likely they are to get blood clots. Age is the biggest risk factor for getting inappropriate blood clotting. So getting back to estrogen, of course. But first you needed to understand what is going on with creating blood clots, because otherwise none of this will make sense. Okay, so estradiol, the estrogen that I would give, doctors give transdermally through the skin to menopausal women does not induce platelet activation inappropriately, not at all. What happens when you have estradiol in the right amount at the right time, it modulates the immune system. Remember, activation of platelets that causes clotting is part of the immune system response to damage and pathogens, infection and injury. Well, estradiol, which I call the master hormone of everything, the master of metabolic homeostasis, it regulates everything. Estradiol modulates or regulates the immune system's response to everything. All the immune cells of the body have estrogen receptors. Different ones have either predominance of the alpha receptor or the beta receptor, and we're going to leave out the G protein coupled receptor for now, because that is like a separate thing. That's involved in everything too. But the biggest focus has been on alpha and beta and the immune system. So think of estradiol as the on and off switch control system. So most of the time you want inflammation turned off. You don't want to just have inflammation. You only want inflammation turned on when you need it to save your life. Well, estradiol is one control in this thing. It controls if you have on or off switch, and it does it through both the autonomic nervous system, which estradiol modulates, and the immune cells themselves. Okay, so estradiol is critical for regulating, modulating the immune system. And I've written papers on the renin-angiotensin system that has both a pro and an anti-inflammatory pathway. Without estradiol, which pathway does it get activated? The pro-inflammatory. Lack of adequate estradiol creates a pro-inflammatory state just through the renin-angiotensin-aldosterone system. When you don't have enough estradiol, the body goes into default system of pro-inflammatory. Well, estradiol, when you have the right amount, it doesn't cause platelet aggregation. It controls platelet aggregation. Estradiol does not cause blood clots. Let me repeat that. Estradiol does not cause blood clots. Now, if you give estradiol by the mouth orally, it doesn't get into the bloodstream predominantly as estradiol. So I don't count that as giving estradiol. I count only giving estradiol that it gets into the bloodstream, and it's still estradiol. If you swallow an estrogen pill that's called estradiol, then guess what? The liver goes to the digestive tract, to the liver, and the liver converts most of it into a different form of estrogen, which I've already mentioned. It turns estradiol into estrone. And if you consume, you swallow oral conjugated estrogen, that's the brand name Premarin, that's what was in the Women's Health Initiative study, then what happens? Well, some of it goes into the bloodstream as equine estrogens. Those are horse estrogens, never to be in a human ever. And most of it gets converted, that is human, into estrone. Now, when you're in a pro-inflammatory state, the enzyme that can convert estrone into estradiol is down-regulated. So very little of the estrone will be converted into estradiol. If you have a non-inflammatory person, then you can have more equilibrium. The estrone and the estradiol can be converted through this enzyme back and forth, but inflammation blocks the conversion, downregulates the capability of the body to convert estrone into estradiol. So you're stuck with a lot of estrone. Estrone is, and this is a little oversimplifying, I realize that, but think of estrone as the on switch for inflammation. It activates the alpha receptor, which is the dominant receptor on the innate immune cells that create the initial inflammatory response, okay? So you go into a pro-inflammatory state when you have predominantly estrone circulating in the body. That's why birth control pills, which have oral estrogen, or even when it's not oral, when it's going through the vagina or through the skin as a patch, the vaginal rings that are for birth control, they do not have estradiol. They have ethinyl estradiol. And ethinyl estradiol acts like estrone. When you swallow it, it acts as estrone. It gets converted. And remember, estrone is like the on switch for inflammation. Now, estriol, which we have in little quantities when we're in the reproductive age or when we give estradiol in the menopause, but in large quantities when you're pregnant, which we're not trying to replicate pregnancy, and we can't. Anyway, that's a whole different thing. But estriol predominantly activates the beta receptor, not exclusively, but predominantly. And think of it a little bit, once again, I know this is oversimplifying, as the off switch. So what's estradiol? Estradiol is the modulator, the controller. It turns on and it turns off. So estriol predominantly off, estrone predominantly on, estradiol on and off as the body needs it. So we don't want to have oral estrogens, okay, of any kind, whether it's estradiol or conjugated equine estrogens, because they predominantly enter the bloodstream as estrone, and we want estradiol. So birth control pills do indeed increase blood clotting because you have this imbalanced situation. And when you swallow estrogen, it goes through the liver, and this abundance of estrogen in the form of whether it comes in as estradiol or equine estrogens, it activates certain production systems in the liver, and the liver actually starts making more clotting factors, which increases blood clotting. So it's working on the platelets, but it's also creating more blood clotting factors in the liver. So it's like the perfect storm. Now, fortunately, young women and healthy women have such a low incidence of having blood clots that even though the risk percentage-wise, when you have oral contraceptives or other forms of hormonal contraceptives that have estrogens in them, even though they're actually, from a percentage point of view, significantly increasing the risk in absolute numbers, because these are rare events. Like, if I'll give you an example, say something happens once in 10,000 and you double the risk, which we're not doing, you double the risk, then it's 2 in 10,000. So it's still an uncommon event, right? It's still rare, but you've actually doubled the incidence. You see, because the incidence of blood clots in younger women is so uncommon. Now, if someone has a clotting genetic propensity, like they have homozygous factor V Leiden, that's a chromosomal kind of related blood clotting propensity. And if you got 2 of the bad genes, okay, if you get 2 of the bad genes, that's called homozygous, okay? Now, if you do not have the factor V Leiden and you take the conjugated equine estrogens, your risk of having a blood clot goes up 4-fold. If you also have factor V Leiden homozygous, your risk goes up 16-fold, 16 times higher risk of blood clotting. That's huge, okay? And that's whenever you would take it, okay, including with birth control pills. So most women who get a blood clot, thank goodness it's rare though, with birth control pills will have either a risk factor for having a blood clot, like they're obese, or they have PCOS, which inherently has an increased risk. They have other inflammatory risk factors, like maybe some autoimmune disease, or they're a smoker, or they have factor V Leiden, particularly homozygous. Well, the reality is if you take estradiol pills orally, your risk of having a blood clot doubles. Let me repeat that. If you swallow estradiol, your risk goes up of having a blood clot 2 times. If you swallow conjugated equine estrogens, your risk of having a blood clot goes up 4 times. If you also swallow conjugated equine estrogens and you have factor V Leiden homozygous, you have 2 bad genes, one from each parent, then your risk of having a blood clot goes up 16 times, okay? What if you use an estradiol patch? What does your blood clot risk go up? 0. It doesn't go up at all, okay? Estradiol modulates blood clotting. It doesn't cause blood clotting. There has to be a reason in the body, like damaged tissue or infection, that will cause estradiol to turn on inflammatory response. Now, let's talk a couple of minutes about how estradiol actually keeps us from having blood clots. Not only does it modulate it, but it actually prevents blood clots in a normal situation. So how does it do that? Estradiol increases the production of a gas that is anti-platelet aggregating. It prevents platelets from aggregating. It's called nitric oxide. Estradiol also increases prostacyclines. Prostacyclines also lower the risk of blood clots and platelet aggregation. If you like Googling, Google the following: estradiol and nitric oxide reducing blood clotting, or estradiol and prostacyclines reducing blood clotting. So it's the opposite of perhaps what you've heard, which is that estrogen causes blood clots. Estrogen is not a thing. You got to look at what estrogen. If it's estradiol, estradiol lowers your risk of blood clotting under normal healthy situation, and it modulates it so it turns it on when you need it, not when you don't. Estrone, which comes from the hormonal birth control, when you have an estrogen product, that increases blood clotting. And this is what has been so confusing. If you take hormones in menopause orally, whether it's conjugated equine estrogens or estradiol, you will increase your risk of blood clotting. So don't be afraid of transdermal estradiol. It does not increase blood clotting, and that has been actually quite well studied and shown that it does not. And we know the mechanisms. Now you know, through nitric oxide and prostacyclines. That doesn't mean that a person who uses transdermal estradiol cannot get a blood clot. Women can get a blood clot because other things can be at work. They could have an infection. They could have a blood clotting genetic disorder that has never been diagnosed. There's more than just factor V Leiden. They could have an autoimmune disease that increases systemic inflammation. They could have, like I mentioned, chronic infections. So they could have a variety of reasons. And getting older, I already told you the biggest risk factor for getting a blood clot is aging. So anyone who is in a chronic state of inflammation will naturally have a higher risk of getting blood clots, because if they're in a higher state of inflammation, then their clotting mechanism is being activated to some degree all the time. That's why we emphasize anti-inflammatory everything, because we don't want to have spontaneous, inappropriate, potentially life-ending blood clots. So there you have it. That's a lot of information. You're not going to have a test, but just remember, estradiol transdermal does not increase blood clots. Estradiol controls when and if we have inflammation, and part of the inflammatory response is the creation of life-saving activation of platelets, which includes blood clotting. And now you know why. So we don't bleed to death in a trauma, and we can wall off abscesses and infections. So estradiol is the modulator of the inflammatory response and of platelets. Platelets are modulated by estradiol, and they do not spontaneously cause blood clots inappropriately because you have estradiol in your body. Quite the opposite.